I was kind of an out-of-control diabetic. I can never really keep my numbers steady in one spot. They'd always be too high or too low.
It was scary. I mean, and it still is scary. He didn't care. I think there was a cross between that, just wanting to be normal, but it's just him needing to get to the point that he takes ownership of the disease and accountability for it.
I knew that he would really benefit from someone to pair with, to help him coordinate his care, help him to overcome some of the daily obstacles a teenager has with managing his diabetes.
So the NICH program is a population health program. We target youth who are medically complex and have chronic health conditions, but also experience social vulnerabilities. We have evidence to believe that those things actually drive health outcomes and impact their ability to take care of their children.
Working in embedded care, I work with children and youth with chronic health conditions, and what I know about them and the families is it's extremely hard for them to move around seeing all the different professionals that they have to interact with. And they often get lost in the process of having to go around to all these different providers.
We joke that niche actually means nothing I can't handle, and that's pretty close to sort of my mindset and sort of my job, what I do. So the kids and the families that I work for, any problem that they're having, I try to help them face it and come up with resources to solve the problem.
They get 24/7 coverage, so we know problems happen all kinds of different times during the day and night. They get an advocate to help them navigate a broken healthcare system, and they get somebody who has undying compassion and truly understands the challenges they have.
Once you look at the whole person, there's all kinds of things that people struggle with. My job is to help them with the medical issues so that it gives them enough resources to deal with their medical situation. Having diabetes and stabbing yourself constantly is not fun, right? So if we can pair that with a positive reinforcement, like $5 towards something that he wants, then that's what we're trying to do.
One of the things that they are doing is they have to, he has to FaceTime with them like every night. And so there's this huge accountability factor because he has to show what his numbers are. And
I call him on FaceTime, and he gives himself his long-acting insulin. And that's a really big deal for type 1 diabetics, to give themselves their long-acting insulin consistently. And so whenever he gives himself his long-acting insulin on FaceTime to me, then he gets $5.
More often than not now, my numbers are, within range.
Over the last few weeks, he's done amazing, and but he's really seeing how well he's feeling.
I think he started to see that he can succeed at managing his diabetes. He doesn't have to be perfect.
Dawson's really benefited from the relationship he's had with his NICH interventionalist and been able to build trust with him, which I think sometimes has been a challenge for Dawson to do. And this person has been someone he can count on and rely on and brainstorm with ways to better his care daily.
Having a male influence is a huge deal. Them going kayaking or, on hikes or different things, or just BSing because it's a different, point of view.
there are no shortcuts with the most challenged and the most challenging. And so it costs money if you want to do the right thing, but ultimately everybody benefits both financially and health-wise in the long run.
I love NICH. I think it is wonderful for these chronic health conditions. I would love to see it expand in our community. There are so many families struggling with chronic conditions, be it a physical or mental behavioral health issue, and I wish that we would have more opportunity with them.
I think it's just an awesome program to come in, and I'm really happy to be a part of kind of a pilot per se program here in Bend, just to get it off and running, and I think it's pretty cool.
I think this is a stepping stone in changing care for those people who are most challenged by their health. And that is people who have social challenges. Those are the people who are disproportionately impacted by their health. Besides patients and their families, the people who do the work, their lives are forever changed. Doctors and nurses who take care of these patients, their lives are forever changed. It's really quite remarkable. It's like a domino effect that as you improve the lives of these young people and their families, everybody seems to benefit.
I've kind of taken the initiative to, with help from NICH, to do my shots and get all that back on track.